The numbers, yeah.
Everybody ready?
Yeah.
Okay.
Ready.
So let's call this meeting to order on Monday, November 3rd, for Health and Human Services. May I have the call to order and now the roll call.
Kay Wilson,
Here.
Tweet Schuman,
Here.
Marshall Savitsky,
Here.
Chuck Van Etten,
Here.
Jeff Haney,
Here.
Lorraine Gouget, Don Pettit,
Here.
and Dr. Dunlap. You have a quorum.
Thank you. Shall we stand for a pledge of allegiance, please?
Yeah.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And thank you, everybody, for changing your meeting date for tonight. Do we have certification of compliance with the open meetings law?
This meeting was noticed to the media and the public as required by Section 19.84 of the Wisconsin statutes.
All right, we have an interesting agenda, so let's continue. Any public comments? Online? All right. Can we consider approval of the minutes from our meeting on October 7th?
I'll make a motion.
Motion's been made and seconded to approve those minutes. Any discussion?
Why?
All in favor?
Aye.
Opposed? So carried. I beg your pardon? Okay. Did you hear that, Liz? Okay. For our next number 9, do we have a LCO liaison report? Could you turn on your mic? Thank you.
Here?
Yep.
Oh, okay. Can you hear me? All right. I just want to give an update because I was ill, so I wasn't able to attend meetings and be here. So I'm catching up on everything. But I did want to, announce a few things. At this time, through the tribe, we're trying to take care of our people the best we can with what's happening now, with the cuts that are coming and things taking place. And so we're going to be feeding the people the best we can and we're working on a food drive, we're working on food distribution and then meals in the villages so that we can feed the people. We're trying to spread it out so that we can hit different spots and people can go where they can and be taken care of. And we're trying to work through the elder program best we can to keep feeding our elders, keep feeding the people who are in need. So we're going to provide what we can and taking care of those who are like on the SNAP program, the programming, the assistance who need that for the families, so all ages. And I wanted to update now, like with our new clinic, we have an assistant now to the director. So we have a director assistant. Mariah Austin is her name. So she's joined our clinic now. And I'm not sure if I touched on this before, but we do have the new providers now in place. So we had 3 new nurse practitioners added to the staff. And 2 new dentists that's going to help take care of the people. And Dr. Malcolm signed 1 more year to be with us at our clinic. So he'll be there until December 26, 2026. In our transportation department, we've been working on that area also. Within the building, the facility itself, they have an area that they switched over to until we can provide urgent care. So it opens up more and accessible to the people. So the transportation to help those get to their appointments and assist them in ways that they need that, they can connect quicker with the people. And with the construction of the building, the pharmacy, the drive-through was needed to be addressed because it was too short and it was too close. So they're trying to replan that to make it more accessible for the patients. And we're in the process of working on a supportive housing project to support those who have that need. So we're still in the planning and working towards that, but we're going to keep moving towards that to help take care of more of our people who fall into that population. And then we continue to provide the services we can through their behavioral health programming and to help those who are battling with addiction, need that assistance. So I just wanted to share a few things with you. I'm catching up now on things. I was real sick, but I'm getting better now, so I'm back.
Good, thank you very much. Do we have anything from the Senior Resource Center?
Let me read that report that she emailed us with. Oh, it's up there already. Besides what's on her report, nothing really, I guess. You want me to read it, or? You guys probably already saw it in your packets. Is there anything else, Jeff, that we talked about that last meeting? I don't think so.
Until the spring, we try to get more. And try to raise it.
Is there gonna be a budget amendment maybe coming up at our county board meeting for the senior resource center?
The way it's.
Because
like, bring
we're
it
giving
up.
them, we're not giving them what they asked, right?
Right, $10,000 short.
Right.
Mm-hmm.
So I'm just wondering, was there any talk about that, or are they gonna try to make it with that shortfall, or?
She increased some of the wages or the cost of meals, I know, going forward. She's gonna try to work it out whether she gets that $10,000 or not. She's gonna make it function, she claims. But some of the people who helped her fundraise that $50,000 to raise her up this past year, whatever it was, they have moved from the area, so she's not gonna have the help that she had in years past. So I don't know what she's gonna do if these fundraising efforts are really gonna, pull through for her to keep the seniors, I guess. So
They have done a nice job of fundraising though.
they have, but it's a work of very few, and a few of them, like I said, moved out of the area or quit the board. Like it says in the packet, there's 3 open positions on just the Senior Resource Center board alone. We don't have a representative from the Winter Excellent area. So always looking.
Okay, administration. Julia, do you have anything to report?
Yeah, is Carrie on?
Yes.
Carrie, do you want to speak a little bit to the EMR getting up and running, if you're able to hear and talk?
Yeah, sure. Are you able to hear me?
Pretty
Well,
good.
A little bit.
Talk loud.
Okay. Can you hear me now?
That's better.
Okay. Okay. So we did kick off today going live with our new EMR, which is our electronic record system. So hoping to help bring more synergy within the department and help to identify clients that are in multiple programs. So far it's been successful. This was to replace our old system that did not have the robust capabilities that this one does. So we'll be able to track our clients a lot closer as to what programs they're in and really have some better interdepartmental communication.
So that's really been the big update. It's going quite well with the training. People have been pretty happy with it coming forward. So that's always impressive when you're putting on a new electronic health record. So that's our focus, and it's going to really help us with some streamlining with some of the areas. The other thing that I put under administration was a food drive that we started on the 29th, and we'll be going through November 14th. So we've also encouraged others, if they want to have a food drive in their own businesses, go right ahead. And if they would like us to do the distribution, we'll come over and pick up things and get it distributed. So we're looking at distributing Hayward, Stone Lake, LCO, and Waldo Center. So between the 4 places. And it looks like it's going pretty good. Yes. Well, we looked at the 4 main to get throughout the county. So that's why we picked those 4 places to distribute to. Oh, no, we're distributing to the food pantries. Yep, the 4 different food pantries. That's what we're doing. Yes, otherwise it's like, that's their specialty. We're just getting them the food and they can distribute it.
From what I saw in the lobby, it's been pretty successful.
It's looking pretty good. We're going to keep pushing. So, yeah, so it's going over pretty well. Okay, that's it.
All right, well, let's move on to Aging and Disability Resource.
Okay, Carol's unable to be with us tonight, but some of the key things that they've been working on over there, getting caught up on APS World. We did have those Chapter 55s that we talked about last month. Those are kind of getting closed down and moved into guardianships, and so that's moving forward. It's also Medicare open enrollment, which started October 15th, goes till December 7th. Shannon is new to that position for being able to help out with that, but she did finish all her training and is doing a great job according to Carol. And then we have just wanted to note for the dementia care, the 2 dementia care specialists. So we have one for Sawyer County, which is Joni, and Angela Beckman is with LCO, and they are both on WRLS Lifestyles the last Tuesday of every month at 8:30, talking about dementia, resources, and things that people can do. And then the final thing is just to note that November is Alzheimer Awareness Month and the National Family Caregivers Month. That is it on that report. Does anybody have any questions in that area?
All right, let's move on to behavioral health.
Okay, I think Alicia might have had a quick couple things to update on, Alicia.
I do. I think the biggest difference or something great to report is we are moving forward with CCS. Caitlin, I'm not sure if she's on or not, but
She's here in person.
oh, wonderful. Prior to this, my report was written prior to Caitlin getting everything taken care of with Taylor County. But she is ready to go as a psychotherapist for our CCS program. And we are going to be starting with our first client this week with the initial phases of getting that person enrolled in CCS. So we've got one for sure that we're starting this week. And then Haley Sands, who's our service facilitator, she will be meeting with our second client on Wednesday, potential client, a 15-year-old. So I'll know more on Wednesday about that. And then this week we our new employee for the CLTS program, she started today, Chelsea Nelson. So she is going to be replacing Terry Brown, our service and support coordinator, and Terry's last day is November 21st. So the next 3 weeks, Chelsea will be busy with lots of training that she has to do per state requirements through DHS to become a service and support coordinator. So those are the 2 really good updates I had for tonight.
Okay, thank you, Alicia. Community support and mobile crisis. Did you have anything additional you wanted to add to your report, Caitlin? Okay. Unless anybody has any questions for Caitlin, her report is in there. Okay. Moving through, we have both the mental health monthly expense report and the cost by client report. I went through that there aren't any major changes from last month. I think we discussed that quite a bit. Any questions on that? Okay.
Well, then we can move on to child, youth, and family services if there aren't any questions about all the money we're spending.
Yep, it is. It's interesting to get those clients in and moved out, right? Okay. Child Protective Services. just wanted to make just a couple of notes for the out-of-home care. We had 27 who are in out-of-home care as of November 1st. 18 of those are in foster care, 5 are in residential, 3 are in institutions, and 1 is in group home. And then of other note is from January to September of 2024, we had 172 reports. And from January to September of 2025, we had 204 CPS reports that have come in. So when they're telling me they're feeling a little bit busier, I can understand why. We're screening in and following 72 cases, getting them through the system. So that is what's happening in CPS world. YJ, Sarah has included a report there. And, oops. Any questions on that report? The other information that I added in there, it came through from the Children's Mental Health Office on attendance, absenteeism, and mental health. And I think this just goes to kind of speak to our wanting to make sure we're getting kids in school and really taking a look at truancy and keeping kids in school and the positive impact that that can have on mental health. So just wanted to include that report. Yeah, Lorraine.
Can I make a comment? One of the things that was brought to our attention was the increase in alcohol use with those younger
With the
ones.
kids.
Yep, with the younger people, and how that's affecting behavior, and that's how it's affecting school, attendance, everything else. But that rise in the alcohol use, those are things we got to watch.
And we are noticing that, like, just on the YJ side of things, most of the kids do have alcohol use along with other drug use. Our ankle monitors now do detect alcohol use. So if they are on an ankle monitor and we're keeping them home, there's nothing better to do than to try to get into somebody's liquor cabinet or have something brought over to the house. So we are now actually adding that to the ankle monitors. And I'll make sure that we also talk through that at Prevention Coalition. That's been one of the things that's been brought up as well.
And then the services that they may need, the
Mhm.
help they may need.
To get
I know the tribe used to work with different entities that were kind of inpatient care. And I'm not sure exactly where it's at now. I can take a closer look at where things are and to make sure we get those kids help as quickly as we can when we start to see them struggling, because some of them are caught up in the system now, the behaviors. They're getting
right.
caught up, and you don't want them to continue down that path. And so anyways, I just wanted to touch note on it.
That you're seeing that too.
So we had a report before about how they were doing with truancy and their program and how it was working. And do we have that?
We don't have anything more specific tonight. That this meeting came awfully fast
Yeah.
on the back of the other one.
Okay.
Continuing to go really well. We still have, well, last I heard, 32 in the truancy diversion kind of programming that she has been following and helping to get the kids to school. So
Are businesses voluntarily contributing these gift cards and gas cards, or are we buying?
they're part of the grant. The incentives are part of what we wrote for in the grants.
Okay, so we're buying them.
But yeah, we're buying them with the grant funding, but
Right.
when that starts to go away, we're going to need to be soliciting people to be able to help support us through donations. We'll have pretty good grant funding through 2026.
Shall we move on to economic support?
Yeah, that's probably the biggest area that we've seen. Is Shauna on? I just don't want to overspeak if she's on there. Okay. All the reports are in here of things that we thought would be important for everybody to know what is happening with economic support. When we get to A is just her standard report that we've typically had. When we get to the error rate report, we're paying really close attention to that because that error rate is going to make a difference for us when we get into the following years when the administrative burden costs could increase if our error rate is high. So we want to keep a good eye on that. On the next one, the talking points for the benefits being delayed is in there. The mailing that people on the food share program received is in there as well. Of note, today, we just heard that partial benefits are going to be put on to the Quest cards.
50%.
Is that what it ended up being? Because I didn't even see the
That's-
total.
Yeah.
So we're kind of still waiting because we haven't been told exactly what that's going to look like and when those benefits are going to be released to be put on to those Quest cards. So we're expecting to probably be getting some phone calls coming in, but that just came in today or this afternoon for me. So that's as much as I have for an update on that. Any questions when it comes to that? I think we gave you all the information, but if you have any further questions that I may be able to seek out, I can do that.
I would think that there would be an increase in the number of calls that the consortium is going to deal with.
Yeah,
in the month.
potentially when those, because asking questions when those benefits are going to be put on. Interestingly enough, it has, our call rate at first was quite low when that first messages came out that the benefits weren't going to be added. And we were thinking that they probably thought that all staff were off and weren't available, so people weren't calling in, just from our normal call rate. So, but that's picked back up. I think we've gotten some pretty good messaging out there that the employees that really run these programs are county employees and not federal employees who aren't working. Okay, that is that piece. The other piece for E that's included, oh, Lorraine, sorry.
I just wanted to ask, I know maybe this is not the area, but for assistance for heat and anything along that line, have you heard anything on that?
We do have the WEAP program, and now I'm going to forget the ACA, it's WHEAP, but we are running that through the county. So people can call the Health and Human Services and ask to speak with somebody about energy assistance.
Is that going to go to the tribe too, or just the county?
That's for everybody, yep. I think that should just be countywide.
Okay. Thank you.
Mhm. And then the standard reports for the child care certification and the Sawyer County child care numbers are also included in the reports.
I was looking at this running out of people report. I was kind of wondering what that was all about.
Where are you?
It's a family friendliness workshop.
Oh,
strategy.
yeah, sorry. I was like, that is, Northwest Connections is pulling together a group of businesses together to talk about ways to be a little bit more family friendly, to hopefully help keep employees, help keep the workforce going. And so that is a conversation. So the family friendliness workforce strategy, is that what you're talking about? Yes. Yep. So they're going to get a group of businesses together to talk about strategies that can help them retain their staff.
Is anyone from the county going to be involved in that discussion?
I'm sure some of us are going to go. I
Okay.
don't know that Mike has even seen that yet, so it's part of, it just came through and popped on there, and we had a meeting together, but we didn't talk about that. But definitely, given the fact that we're talking about workforce retention as part of our strategies, definitely will be attending. Okay. Anything else within the economic support report?
No, so I think we can move on to public health.
I think Julie just has a couple of updates outside of the report.
Yes, so since the written report was submitted, we did have our second annual community stakeholder meeting at LCO University. Last Thursday, we had 39 individuals from around 25 organizations represented from Sawyer County. We discussed the root causes of our identified priority health areas, and it's a good meeting. Any questions?
What were they, the top priority ones?
Oh, our top priorities?
Yeah, 'cause I didn't see that.
Substance use and alcohol use are kind of one priority. The second priority is mental health with social isolation as a determining factor. And the third area is looking at basic needs. So that encompasses housing, healthcare, childcare, transportation. So we're kind of looking at all of our health needs under those three categories. And so we divided up into small groups and they shared we did a root cause analysis with the participants that were there.
And looking for people to be part of work groups, Lorraine, if you want to join.
Thank you.
Okay. Fiscal.
Okay, we've got the typical roll-up reports in here. I think one of the key things, so we've got that roll-up report. We know where our expenses are hitting us is in our auto care expenses. We have some kids that are going to be transitioning out of placement pretty soon, so that is going to be helpful. We're working on long-term care placement that we have for mental health. We're trying to create an environment where we're able to bring a couple of our more difficult clients that are placed outside of the county back here to help reduce some costs. So we'll be kind of looking at that as we move forward. As we move into the pages 52 to 57, that is that new updated purchase services recap report along with the receipt. And one of the things to note now is we did not anticipate any funding coming in for CPS case management or youth AIDS case management. Those are some areas that we are now able to do some billing with thanks to Carrie getting those pieces set up. So as we move forward, we hope to get those even higher as we get better with our charting and pulling clients in. So those are kind of avenues that we have for trying to recap some of the revenue that we have not had in the past. We'll also, obviously, you heard from Alicia about growing the CCS program and moving that forward. So that should also help increase some of those revenues.
Good question. Julia, so the people that are currently being served out of the county, right? At these other facilities, you talk about being able to bring them back within the county.
Yeah.
What facility do we have here that we could safely house them in? And
Well, we have transitions and we would need to be relooking at how we use that environment to be able to bring some of the people back. One of the things that we are missing when we have them on out of county is we have a wonderful CSP program, but they just can't spend the time with them when they're 5 hours away, versus if they were right here in town, we'd be able to have much better assistance with them. Basically, what's happening with a couple of clients now is they're really just being housed and not really getting a bunch of treatment. It's more of managing the behaviors rather than the treatments. So we're trying to mix things up and think of different ways of being able to manage these things.
do we have openings and transitions or some of these other?
We don't in a way that we would be able to bring back somebody that is the higher needs, but we're working on transitioning people out. We'll have to do training with our staff to make those changes.
Will we need additional staff for that?
Probably a little additional staff for that, because some of the clients will need more one-on-one than what we have. But in the long run, it'll be cost effective compared to what we're paying right now. And we get them in an area that's closer to here, and we hope that that will be better for their health too.
I know Marshall's brought up before, buying a house and developing something. Is that something that could be put on the radar for 2026, 27?
Well, we have a place. I mean, what additional?
I don't know. I think it was like I don't know what we're talking about. I don't know how long ago that was now, but if it was like a school that they shut down or other bigger building
Oh.
area that we could refurbish and put rooms in there with whatever mechanisms, locking doors, whatever would have to happen. I don't know what these facilities require or whatever for these people,
Yeah,
but
yeah.
it'd be cost benefit in the long run because we were looking
Right.
at numbers, it was like in the millions that we'd save, especially over 10 years' time, you know?
Yep, yeah, and that if we can repurpose and use transitions in a different way, then we already have a building. And that would be probably and then if we need more, if we find that we're still gonna need more placement, then I think that that would be something that we need to think about.
How many do we have out of county now?
Out of the county, we have, well, it, it depends if we're on crisis versus just living outside of the county. We have 2 living outside of the county now, like long-term placements, not counting when we have somebody that goes to Winnebago and then comes back. That person, one of our people happens to be in Winnebago, and that's why we lost the placement and trying to figure out a way to get a better placement. So we've got 2 there. The other 2 are here already at transitions. So we're already, even though there's cost there, that's built-in costs that we've already been planning on for the years. So it's better that they're there than having them someplace else, and then we still have the costs at transitions, if that makes sense.
Yeah. So we're spending $341,000 on one person in a year. If we buy
Mhm.
one house, put 2 people in there, you're
Mhm.
money ahead already in just 1 year's time, but.
Mhm.
What is the capacity at transitions?
Well, we would change it. Right now, there's 8 beds in there. We couldn't have 8 beds because we're going to change the clientele. So it wouldn't be 8
Is
beds.
transitions the building that we had the COVID clinics?
No, that's the old Oasis building. So that's what we used to have for youth housing, out-of-home placement. The county actually owned that, and we used to place youth there. And then, Tweed, you were on the board. I don't know if Dr. Dunlap was on the board at that time when that was decided to close that down. And then that got transitioned to the ADRC and the vets.
So where is transitions?
Oh, sorry. It's by the Marshfield Clinic and the Restore, which is not the Restore anymore, I don't think, but over there off of 63. Are you familiar with where I'm
Yeah.
talking about? Yeah. Right back in there.
Thank you.
Mhm.
So do we have anything more to talk about in the fiscal department?
I don't think so.
So we're kind of towards the end of the year and looking at our budget. Did our new budget accommodate some of these extra expenses or?
Going into 26?
Yes.
Going into 26, we're trying to be able to reduce some of the expenses. The goal is CCS program, growing that, getting more revenue coming in that way. And then also looking at reducing some of those out-of-home costs by transitioning some of those out-of-home placements here. So we're strategizing really hard in that budget. I came in a lot higher on that budget than where we ended up at. We had to do because
Cutting.
we need to try to figure out how we could cut.
So at one time, we talked about the transportation expenses.
Mhm.
And did that get resolved?
Well, we're using transport that is less costly
And then-
for us. But then the other piece is the sheriff's department is doing more of that transport. So we're not necessarily not having transport costs, but they're not so much in the HHS budget,
Okay,
if that makes sense.
Well, and we increased our fees, right? You just kind of added that to the budget, that
A
we
little bit.
charge more for some services.
Mm-hmm, mm-hmm. And we're getting better at billing for services. So I think that that's the other important thing.
And were we also going to share a provider with other counties so we don't have the entire expense, or was that more to recruit someone?
Hey, what are you talking?
Like in CCS and then we were always waiting for a psychiatrist or some, or
Oh.
a doctor or a practitioner
Yep, so
that we were in
Caitlin-
search of forever.
Caitlin's on. Caitlin is just got certified in CCS. And we are looking at somebody else being able to come on 4 to 8 hours a week. We'll share that next month when we get everything finalized. So that will also help us be able to have those therapists. And then looking at other services that we're providing in-house that could potentially be CCS services to be able to bill for things that we would already be doing.
Mike, do you have anything to share?
I was just gonna say Julie and Carrie have done a wonderful job, really digging deep and looking at things we could get a little more efficient at, ways to generate some more funds to kind of close that budget gap that we had. So we've been meeting regularly. We just met Friday and she gave me some updates on what's going on and very encouraging. And it's working even this year. We were running almost a month ahead on the budget, pretty much all year until maybe August. And now we've got it down where we're just a couple percentage points ahead. So it's working already.
I know at the county board, it's always HHS, that's taking all the money. And it's good to hear that the expenses are,
Yeah, and one of the things we've talked about as a team, actually, those three back there, Joe, Caitlin, and Cole, like if we could pull together some more reports just to kind of see who all we've been touching in the mental health world, what we're looking at, and because there's a number of crises and things that have happened that haven't resulted in out-of-home costs as well, that if we didn't have these services in place would result in even higher expenses, so. And if that is helpful too, even going to the county board or here, we certainly can pull that together.
okay. Are there any board-appointed committee updates? Do we have any correspondence or reports from conferences and meetings?
Do not.
Any future agenda items that anyone would like to see on the agenda? I thank you very much for doing such an excellent job with all the reports. It's pretty incredible, I think. So let's adjourn.
Okay.
Thanks. Good night.